Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Hello, everyone. Welcome to the I Am You podcast. I'm excited to be joined today by celebrity Miss MaryAnn, which you might recognize this face from the docuseries episode number 1. MaryAnn, thank you for being here one more time to share your story.
Thank you for having me. I come back again and again and again. I just want somebody to get the message. This is why I'm here.
Oh, love it. Thank you for, not many women are willing to share their story. And when we find somebody like you that is willing to share not only the journey through the healthcare, but also help us understand the experience through somebody that already have some cardiac conditions, to help the listener to understand that we have to be our own advocates. And I think that if there's something that you had done very well is help us spread that message. So before you were diagnosed with your cardiac condition, you were explaining to the doctors that you were experiencing a burning feeling in your chest, no? So that's what you were expressing. Do you share that with other doctors before you ended up in the emergency room? Have you ever had an endoscopy? Anybody suggested, let's do an endoscopy? Did you visit a gastroenterologist in your life because you were having that burning feeling in your chest?
I finally did, yes.
And what did they found?
They found the reflux.
They treated.
And they treated it.
Did the burning went away?
Yes.
Okay, so when you had, when you came to see me, you were expressing that there was symptoms that you could not understand what was causing them. No, so for a very long time, you thought that gastroesophageal reflux was your problem, but despite using medications for it, you were still getting that indigestion feeling.
Yes.
So do you feel that you were adapting to that indigestion feeling? At some point, MaryAnn, do you feel like, well, it is indigestion. It's not getting better with the medication, but they told me it's indigestion.
I did. I was getting used to it, but then I got tired of it, and I came for my regular checkup with you. And because I had other issues going on in my life with my daughter who has cancer, and you don't want your child to be sick, I felt something else was going on. So that's when I came to you, and you medicated me right away, and I was able to get through this phase of my life with her.
So for the women that are listening to this podcast today, I want to emphasize the indigestion problem, no? Because it's a very common symptom in a woman when it comes to heart disease. So when we met, you already had been expressing that you had been experiencing indigestion for a few years, no? And then once you came to me, and I understand that your symptoms were worse, and you had the stress of your daughter being diagnosed with cancer. And at that moment, you might have thought that the stress was actually aggravating the symptoms, not knowing that stress is the number one aggravating factor for microvascular disease, which is a cardiac problem in women. No, so that's why when you said, then you medicated me, and then I got better. I want the listener to know that I didn't give you more protonics or nothing for reflux. When you came in and you are expressing, I am feeling this indigestion, this burning feeling in my chest, and I'm very stressed out with my daughter. And as I listen to you, is a typical symptom of microvascular angina. But not many women stand in front of a man or a provider in general, because the gender is not what matters, the recognition of the disease. How many women do we have that die complaining of indigestion because they stand up in front of somebody that didn't recognize that that is one of the most common symptoms of heart disease in women? So your story is so relatable to so many women, but those women are popping up TOMS or using medication to help, and then they know that there's something that is not right. So I want them to listen to your story and understand that there is a cardiac problem that they had to attend.
Absolutely, absolutely. And I don't know why they just take it, for granted that this is this is definitely reflux.
What do you think that is?
I don't know, because why would you want to be in this much pain? I don't understand. Well, they don't want to bother
Do you
somebody.
think, exactly.
They don't want to bother anybody. They don't want to bother the doctor. They don't want to bother the ER. They don't want to.
And why do you think they don't want to bother them?
It's the way they grew up. It's the way we were raised. You know, it's just the way women were raised. You know, the husbands, no. We were raised. Let's not bother anybody. We're the caretakers. So, but we have to learn to take care of ourselves.
So you feel that, based on your experience, that we grew up like, don't be an inconvenience for people.
Exactly.
Exactly. And that mentality has caused the life of so many women because they don't want to be an inconvenience.
Right.
And even those that speak up, sometimes they end up thinking that they're an inconvenience because, you know, gaslight does exist in the healthcare system where they do say something and they're being told so many times that it's not real that they ended up believing it. And now, because I would not think that anybody wants to suffer with burning in their chest all day,
yes,
or on and off, and not knowing what is going on. I'm not sure that any woman will stay quiet just because that doesn't bother them much. It's more about I already said something, they're not listening to me, or they say, well, they told me that it's nothing to worry. So what would you say to a woman that knows that something is not right, but they have heard so many times, it is okay, don't worry? What would you say to that woman?
It's not okay. You need to have this checked. You need to go see a doctor. And if you get the answer, well, it's nothing, go see somebody else. There's something wrong. And that's what I did.
As long as you don't understand what is going on, I think that that's actually the message. Is like, if you know that something is not right, but you're not getting the answers, don't stop there. So either seek a second opinion, look for somebody else that can help you out, or but don't stop speaking up until you get an answer. I think that that's super valuable. Would you think that when a woman presents to the emergency room, you have been in the emergency room and you have had that experience? Do you think that if your husband were to present to the emergency room with the symptoms that you were having, that he will have been dealt with differently?
Absolutely. Absolutely.
Why do you think that?
Because that's what men, right away, they see a man coming in, oh my God, he's having a heart attack, he's having chest pains. They see me coming in, they go, oh, all right, let's do this, let's do that. They just seem to take it in stride. They never say you could be having a heart attack or whatever. I've been to
that's like a second thought. That's a secondary thought.
I've been there twice to the emergency room because of chest pain. Twice. And both times I was treated exactly the same way. And in fact, the second time they were going to send me home. I went, oh no. I said, I want another opinion. And I meant that. Of course, my husband's over there turning red. He's getting embarrassed. I am not. I'll say it to my dying day. Just stand your ground, because there's something wrong. You're not there because you're a woman who's got mental problems. You're there because you're a woman who's having pain. Pain, and it hurts. Mm-hmm.
And don't let anybody make you even second guess that. No, that's another way of gaslighting in healthcare. It's like, is it really that bad? They start questioning, oh, maybe it's not that bad. Maybe I should go home. Like,
right.
Oh my God, I'm so embarrassed, that I wasted your time. Like, it's incredible to hear the stories of so many women that apologize for seeking care, that they are saying, I'm sorry that I wasted your time. And they have even told me that. I have patients that come to the office and they said, I'm sorry that I'm wasting your time. And I'm said, no, you're not wasting my time. I don't want you to ever feel that you're wasting anybody's time, because number one, you live in your body. You're the only person that can say, how does he feel when you're in that body? And you should not let anybody believe that this is in your head.
That's right. They honestly think it's in their head. They honestly tell you it's in your head. And they give you that, attitude. And I get crazy. I do get crazy. You think I'm crazy now when you see me in the emergency room. Oh, my God.
So, MaryAnn, then when you go crazy, they go like, here she goes, hysterical again. And then that's another label for us, no? Because, of course, so many times women have to recur to making extra noise to be able to be heard, no? so many decades of not recognizing our symptoms, indigestion, shortness of breath. I'm just, symptoms that are not the typical symptoms for men. So they need to over express, react so they can be heard. Not because they want to overreact, but because they're dismissing them. And for the listener, it's important to understand that if you have to stick to your ground and raise your voice, or like you said in the episode 1, you don't have to be disrespectful. Just say it.
Just say it. Yeah,
and it's okay. I think that if our woman understands that it's okay to say, I disagree with that, I would like to hear a second opinion, without feeling guilty about asking for that second opinion, or asking for, can I get some other advice? No. So I feel that for the listener, that will be valuable, that we have to give them something today.
And that's so important. And you've taught me that. You have taught me that. And I don't feel embarrassed anymore. And when you want to make a noise, just raise your voice up a couple octaves. They'll hear you.
Joke aside, I think that in order for us to be taken seriously, we do not have to create a scene. No,
right?
Unfortunately, women have been forced to do that so we can be heard. But I hope that with the message that we're trying to spread through programs like this one, like the docu-series, is like for the woman to understand that we're different and it is okay to be your own advocate and keep speaking until you get an answer. But also hopefully for the providers that will listen as well, it's like we need to be on the team with the woman. We have to be able to recognize them. This shouldn't be, oh, you're lucky that you found a doctor that recognized your symptoms. Like for you, MaryAnn, when you came to my office, it should be standard that every woman that go everywhere, anywhere, that whomever is in front of them providing their care, be able to recognize, this could be the heart and we got to take care of it. Not like, you were lucky that your doctor knew that. No, so unfortunately, it's very sad that many times is the provider doesn't have the knowledge because unfortunately, there's not a lot of studies done in women. And then they are trying to diagnose our women with techniques that were created to diagnose heart disease in men, which is a very different condition in men and women.
Oh, absolutely. I feel like the last time when I was in the hospital, that group of doctors were very good. In fact, he did not let me go home that day. He said, I want to run one more test.
So perhaps they already started creating that awareness of, wait a second, this can be her heart.
Right, because I said, okay. I said, everything came back good. He said, but I'm going to run one more test. And
but MaryAnn, do you think that if you were 40 years younger, they will worry about your heart?
No.
That's another thing, no?
No.
So it made it a little easier on you because you're just...
I'm old.
I didn't say that.
77, Sunset Strip. So, and I'm proud of it,
because it's actually obvious that as we get older, the risk for heart disease increases.
Right.
We were just talking about that. Menopause increases your risk for heart disease. But heart disease does not have an age. So if a younger woman go to the hospital with similar symptoms that you were having, perhaps they will not have that extra test done because what are the odds that this person have a heart problem? No?
Exactly. I know it. My daughter's, I ain't going to tell you her age. She'll hit me.
But she's younger than you.
Oh, a lot younger. And I gave her the book. And she read it. She calls me up. I said, what are you calling me up for? Go to the ER. I said, now. She said, well, I said, just go to the ER. 911 or call 911. Take your pick.
So what happened there? You shared, you read my book, you liked the book, and then you decided that you were going to spread the word. And of course, you have a daughter, and which is what I love. This movement of women standing up for other women. I stand up for you as my patient. You stand up for your daughter. Your daughter stand up for their friends. The friends stand up for the other friends. And the husbands stand up for their spouses. So the idea is that once we acquire the knowledge, we pass it on. So you pass the book to her and she read it and something resonated with her.
Right, exactly. That reflux, which she has too.
But because in the book it says indigestion can be a sign of a heart problem, then she said, I need to go and get checked.
Wow.
So the idea of doing this type of events, like episodes like this one, is exactly that. It's like if we speak up, then more women will know. Right. And like the book, like this podcast, is to spark that interest in women to start having conversation about heart disease, and also to, besides education, which
Right.
we've been doing, is also we are inviting them to speak up and continue to be their own advocates.
Absolutely. And that's all I can do is just tell them. I give them the book. I send them the YouTube video. I keep on telling them I'm a movie star.
You are a movie star.
Really.
You are a movie star.
So why wouldn't you want to listen to me? And I'm not talking politics. I'm talking body.
They're listening to a lot of influencers. Why can they not listen to you?
That's right.
You have an experience, so you are
That's
actually
right.
speaking out of your experience. You're
That's
not
right.
making up stories.
And I would never, this inconvenience that we feel is ridiculous. And I don't care what I go to ER for or what I go to urgent care for. I'm there for a reason. I'm having some pain. Something's wrong.
So shall we take from you, I love because you talk a lot about the inconvenience. And I think that that is super important for women, not only of your age. I think that as we go to younger generations, we do have a little bit of more voice, but we still feel that sometimes we're an inconvenience. So what would you say to the woman that is of your age, or a woman that feel like, I don't want to be an inconvenience to anyone? What would you say to that woman?
Well, first of all, I want to hit them.
You want to hit them.
I want to hit them.
Because you want them to wake up.
Yes, exactly.
Not because you don't like them.
No,
because
I love
you
them.
wish that it's like, wake up. We're not in that non-time.
And I tell them that. It's no big deal. What do you care? Number one, your insurance is paying them, number one, if you have good insurance. So what is the problem here? That's why you have it, to get checked.
So let's say it's not an insurance issue.
Then
What do you think that a woman don't want to be an inconvenience because of their insurance? I don't think it's their insurance.
No, it's not. It's really not. But sometimes they think, well, I don't want to put too much on my insurance. They may get mad at me.
So they will put a dollar sign on their lives. That's what you're saying. So what would you say to these people that will prefer not to go to the doctor and perhaps save their lives because they're worried about the cost?
The cost.
What would you say?
I always say to them, well, take a couple nights out going to dinner. I mean, you go out to dinner, you spend $40, $50. You go here, you go there. You go on the cruises. I love these women that go on cruises but won't go to the doctor. Come on. Priorities. And this is what I tell them. You've got the priorities. And your health is your priority. That cruise can go another week or another year. But you ain't going to be on it if you don't go and get that checked. That's the bottom line. It's priorities. And I always tell, can't say her name, my friend that all the time. And she's
I love it. You see how she swallowed that friend's name? I love it.
Because, when she hears this, she'll know I'm talking about her. Because I always yell at her. Priorities, my friend, priorities. You are the first priority. And don't let anybody else tell you anything different. I have grown as an old lady, more so now. Because I don't know whether I would do this if I was 40.
I love it. So you had to make yourself a priority for people to take you as a priority.
Right.
Perhaps that will be the way of starting to change the system that doesn't see us. It's like you got to start seeing you in order for the system to recognize you.
Right.
So, MaryAnn, I am so thankful that you decided to come and join me today. I am so grateful for you and for you sharing the story with us. And this takes us to the end of our I Am You podcast. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.